Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Sana. Welcome back to my channel. So, today we are going to talk about the male reproductive organ, penis, and some questions I got in response to last video. And so, I am going to discuss about so I'm going to discuss those with those now. Also, we are going to demonstrate how to wear the condoms. Okay, so let's start. I'll go over the structures, parts, and functions of the penis once again in this video in detail. Okay, the penis is the external male reproductive organ. It has roles in urination, sexual function, and reproduction. So, understanding its parts is very important, and it helps you to identify what is normal and when you need to take a medical attention. Okay. So the main parts of the penis. So we have, I don't have the unerected model over here. So I have the erected model of penis over here. So I can explain the parts of the penis with the erected model. So this is the male reproductive organ, penis. It has a base. The base of the penis is the part that attaches the penis to the pelvic bone. It is inside the body, not visible externally, and the main function of the base is or root is which anchors the penis to the body of the human being. So, second part, shaft, shaft or the body of the penis. It is the long cylindrical part of the penis. Okay, if we do the transverse section of this penis, it contains three columns of erectile tissues. Two corpora cavernosa on the top side, two corpora cavernosa inside this penis, there are three columns of erectile tissue. Two corpora cavernosa on the upper side and or top side, and one corpus spongiosum in the bottom side. These tissues fill with blood during sexual arousal and causes the erection. Now we comes to the third part, the head of the penis or a glans penis. It is this part, the head of the penis. It is round, most sensitive part of the penis and contains many nerve endings over here. The urethral opening, there is a opening on the center of the head, and it is called the urethral opening, which carries urine from the body to outside and also the sexual fluid from body during the time of intercourse. Now let's come to the foreskin. A fold of skin, foreskin or prepuce means a fold of skin that covers the head of the penis. If it is only visible in uncircumcised males, in circumcision we remove the skin covering of the head, that is prepuce. We remove the prepuce while during circumcision. Let's discuss about the internal structures of the penis. So I said before that there are three columns of tissues inside the penis, the male reproductive organ penis, and two columns on the upper side is called the corpora cavernosa. It is two sponge-like cylinders filled with the blood during the time of sexual arousal. It is responsible for most of the rigidity during the erection time. Now let's discuss next column of tissue inside this penis. That is called corpus spongiosum, and it is the bottom part of it lies in the bottom part of the penis. It surrounds the urethra, that is urethra is surrounded by this column of tissue called corpus spongiosum. It prevents urethra from closing during erection. Okay. So this column of corpus spongiosum expands at the end from glans. Okay, From here to here, it expands from here to here. Okay. Now let's talk about the next part, urethra. The tube that is running, this is the urethral opening. The tube that connects urethral opening to the body is tube that running through the penis, connecting from urinary bladder to the external opening is called urethra, and urine is carried through that tube. And during the sexual arousal, during the sexual pleasure time, the semen also or during the ejaculation time, the semen also carried through that opening. The same tube and the same opening is the one which carries both the sexual fluid and urine in males. Now let's look into the functions of the penis. Functions of the penis are urination, sexual functions, and reproduction. Urine passes from urinary bladder to through urethra and exits the body. Sexual function is during the arousal time. Increased blood flow causes an erection. This allows penetration during sexual activity. Reproduction during ejaculation. The semen containing sperm travels through urethra and exits the penis. Now let's look into the normal variations in the penis. Many differences are completely normal, like penile size, that is penis size of the penis varies widely from flaccid to erected state. Slight curvature is common. Color may be darker than the surrounding skin. Veins may be visible, that is all normal. The glands may be smooth or slightly textured. That is also normal condition. Now let's look into the conditions when you should seek a medical advice. Consult a doctor if you notice painful erections, severe curvature developing suddenly, discharge or sores on the area, persistent redness or swelling on the penile area, or that's bothering you, and erectile dysfunction. These conditions, if you notice, you should seek a medical attention. Now let's come to a question which I got during my session. The question is, does the size of the penis have any importance in sex? Medically and sexually, it's less important. The size of the penis is less important than the people think. Okay, let's look into the conditions. Physical functions versus size. During penetration, most of the nerve endings that provide sexual pleasure in females are in the first 2-3 inches of the vagina, or especially in the clitoris and the anterior wall of the vagina. So, extreme length doesn't necessary for stimulation. Second point, in erection and ejaculation, size actually does not affect the ability to get or maintain an erection or ejaculate. Now let's look into psychological and emotional impact of the size. Men often worry about the size, which can affect sexual performance due to anxiety. Now let's look into the variations in size. In flaccid conditions, the length is normally on average about 3.5 inches length, and in erectile state, it is 5 to 6 inches in size. About the circumferences or girth, it matters more than the length of the sensation. Okay. Now let's look into techniques over size. Foreplay and oral stimulation are key for most partners. Communication and responsiveness during sex matters more than anatomical dimensions. Positions can help if penetration depth or angle is a concern. Now let's come to the next topic: how to wear a condom. I have a condom over here. The condoms are individually packed. You can get the wide variety of textured or whatever flavored condoms you want in the market. There is a wide variety, there is a wide variety of condoms available in the market. You can purchase the sizes, variable sizes also available in the market. Now let's look into how to wear this condom. Condoms can wear only in erected state. Erected state of the penis can only able to wear the condoms. So it is an individual packing like this. You should tear the package and take out the condoms from there. It is like this rolled form. It is in the rolled form and it is like this. And now let's look into how to wear this condom. How to wear this condom? Let's try on our model. Put the condom on the tip of the penis, erected penis, and roll down through the length. Okay, roll down through the length till the end of the structure. This is how you should wear the condoms. It has a small projection over here when you wear it to collect the semen while during ejaculation. Okay, now let's look into how to remove the condom after ejaculation. Hold on the condom at the base while pulling out. This prevents slipping or leakage. Okay, like this. Okay, then you should tie or wrap in tissue or throw it in the trash can. Don't this is not flushable, so don't throw it in the toilet. Okay, so that's all about today's video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.